My name is Kylie Christensen. I am doing the skill neurovascular assessment for Nightingale College. I have Landon Alvarado here with me. He is going to be participating in the video as a volunteer. Landon, do you consent to being in this video for submission for a skill video for Nightingale College?
Yes, I consent.
Okay. All right, so I'm going to start with hand hygiene. I'm going to knock into the patient's room, close the curtain for privacy, perform hand hygiene. Hi, sir. I'm going to be performing a neurovascular assessment on today. That means I'm going to be touching you in different areas of your body and with different objects. Are you okay with that?
Yes.
Perfect. So I have my supplies here. I have a Q-tip with a sharp side and a soft side, a pointy side and a soft side. I have a paper clip here. I have a pencil. And then I have my stethoscope because I do not have a reflex hammer, so I'm going to be using the bell of the stethoscope for the reflex testing. Okay. First thing I'm going to do is I'm going to take this Q-tip. One has a sharp side, one has a soft side. I'm going to poke you with it. This is the sharp side, this is the soft side. You're going to close your eyes, and when I touch you with it, you're going to say sharp or soft to identify the side. Ready? Go ahead and close your eyes.
Sharp side, dull side. Sharp side, dull side.
Good. I'm going to do it on each arm.
Sharp side, dull side. Sharp side, dull side.
Good. Okay, next thing I'm going to do, I'm going to take your finger and I'm going to hold it. I'm going to push it up and I'm going to push it down. You're going to close your eyes and tell me if I push it up or if I push it down. And I'm going to do this on both hands. I'm going to do it on both feet. Ready?
Ready. Up, down, up, down.
Other hand.
Up, down, up, down.
Okay, and on both toes. You have to bring it where I can see it.
Up, down, up, down. Down, up, down, up.
Good. All right, next thing I'm going to do is I have a paper clip here. I'm going to either touch you with two sides, or I'm going to touch you with one side, and you're going to be able to tell me which one that is with your eyes closed. Ready?
Ready. One side. Okay. One side. One side. One side. Should I one side?
So then I would document that, and I would measure the distance and document he only felt one side.
Good.
Let me try the other arm. So I would try the other arm.
One side. One side. One side.
Oh my gosh. And same thing, I would document that and then measure the distance and document that. Next thing I'm going to do is I'm going to place an object in your hand and I'm going to have you identify it with your eyes closed. So go ahead and close your eyes, open your hand, and identify the object.
Pencil.
Next thing I'm going to do is I'm going to go ahead and draw a shape or a number in your hand, and you're going to tell me what it is.
A circle.
A circle. Good. Next test I'm going to do, I'm going to touch a body part with your eyes closed, and you're going to identify the body part.
Thigh.
Yes. Okay, next thing I'm going to do is I'm going to do reflexes. So go ahead and let me scoot towards me. First one I'm going to do is the biceps reflex. I'm going to have him relax his arm. I'm going to take the side of my stethoscope. I'm going to feel for the biceps tendon. And then I'm going to tap. What I'm looking for is contraction of the bicep and a little bit of flexion in the forearm. So I would document that as a +2 normal finding. Next, what I'm going to do is I'm going to do the patellar. Ideally, I would be able to have the patient sit with their leg off of the ground so they could relax their leg fully. To note the flexing, we don't have chairs high enough here, so we're doing the best we can. I'm going to find the patella. I'm going to go I'm going to go right below it where I can feel the patellar tendon. And same thing, I'm going to look for contraction of the quad and flexion of the lower leg. Next, what I'm going to do is assess for clonus. So I'm going to take the patient's foot, and I'm going to pedal it a couple times, and then I'm going to stop, and I'm going to look for any, so I'm going to pedal it a couple times, and I'm going to stop, and I'm going to look for any twitching or continue of flexing, this would be a negative clonus. Next, what I'm going to do is the proprioception function. So what I'm going to have you do, your arms are going to be out at your side, and you're going to alternate touching your nose to your finger. You're going to close your eyes as you do it, and you're going to speed up as you go. Go ahead. Good, go ahead a little faster. Good, go ahead and pause. And I'm actually going to pause there because I forgot one reflex, and that's going to be the plantar reflex. So I'm going to take the bottom of the patient's foot. It would be the back of my hammer, my reflex hammer, or I can use the back of a pen. I'm going to start with the lateral side of the foot, and I'm going to draw a J out and towards the middle. And I either want to see nothing happen here, or I want to see the toes curl. We don't want to see the toes flare, so that would be a normal plantar reflex. Next one I'm going to do is I'm going to test fine motor. So you're going to have your hands on your knees, and you're going to place them up and down with your eyes closed, and you're going to go faster. Ready, go. Good. And now with your feet, you're going to pick them up off the ground, and you're going to pedal kind of like you're flipping. Good. Next, what I'm going to do, I'm going to go ahead and stand with you. You're going to stand up. We're going to do what's called the Romberg test. So you're going to stand still with your eyes closed for 1 minute. I'm going to be looking for your trunk swaying or any abnormal movement. So ready, 1 minute is going to start now. That's halfway. Good, open your eyes. Last one I'm gonna do is I'm gonna have you take a couple of steps forward and then a couple of steps back. Here I'm watching for trunk swaying, I'm watching for the feet move the ground, and I'm watching for movement of their arms in rhythm of their stride. Go ahead and walk. Turn around. And after that, that would be it. I would document my results, perform hand hygiene, and that would be it. Thank you.